So what is a psychedelic? So we've talked about this a little bit in the past, if you've seen it, some of the other lectures that we've worked with. So a psychedelic is, what we're talking about is a molecule, a substance that changes consciousness. Some will say alter, some will say expand, but the literal definition means a mind or soul manifesting substance. Okay, and as I said, don't get too caught up on the term psychedelic. There's a lot of terms that people use to describe kind of a similar thing. Hallucinogen, but that's kind of fallen out of favor. Entheogen being more related to using these substances in a spiritual or church or religious type practice. There's empathogen as well. And so you'll see a lot of different medicines. Like I said, I'll stick to psychedelic for now, but that could change, and knowing that that's kind of a flexible term. Okay, so what are some of the main categories of classical psychedelics that we're talking about? So LSD, psilocybin, MDMA, mescaline, iboga, DMT, and ayahuasca, ketamine, cannabis. And so these are large categories. And so when we're talking about veterinary psychedelics, I'm going to be focusing in the future on less, but these are the main ones that are getting a lot of attention, especially in the human realm. So we'll go into each of them in a little bit more detail, and then we'll move from there. So the large classification, we're going to split down into two main categories, so tryptamines and phenethylamines. Okay, so most psychedelics, their main function is to work on the serotonin receptor, the 5-HT2A receptor. And then, so that's your classical psychedelics, which are often labeled as the tryptamines, but the phenethylamines as well have some serotonin receptor, but also seem to have some dopamine release. And I think actually, as we find out more and more, serotonin receptors are kind of getting most of the focus, but there are other things going on, just like I'm assuming with cannabis and the work that you guys do, more and more we find more different receptors that are triggered, or more processes in the body that are being triggered. So we'll stay there for now. Tryptamines, so this being LSD, DMT, psilocybin, 5-MeO-DMT, which is different, and we'll talk about, and iboga are some of the main ones that you're going to hear. So this is, the tryptamines are derived from the amino acid tryptophan and share a common indole structure. Okay, in the future we can go a little bit deeper into the pharmacology, but just know these two main categories for now. And then phenethylamines, so MDMA, mescaline, 2CB is another one that you'll hear that's gaining more popularity. But the most common ones are going to be MDMA and mescaline, which is found in peyote and San Pedro cactus as well. Okay, so the effects can be similar, different. The duration can be similar, different. And that's going to be more dependent on the specific molecule, their specific substance. But typically tryptamines can be shorter acting, and some can be very short acting, a 15 to 20 minute, versus depending on how they're ingested, things like ayahuasca can be a longer term breakdown and can be several hours. But then in contrast to phenethylamines, they're usually a little bit longer and not as, let's say, psychedelic of an effect. So less of maybe the images or the deep maybe hallucinations that people receive are going to be more so with the tryptamine category than of phenethylamines.